All right. Good morning, afternoon, or evening to everyone that can be watching this video at the moment, independently from the race or the economical position that they might have, and also independently from the country that they were born. So I'm really asking you to watch this video because we are gonna be discussing something that can really help with the coronavirus issue. The video is intended to discuss an algorithm that we compile, and I'm saying we because this is just not me, so it's a group of students that I will later talk about. And we compile an algorithm that can help with the logistic using techniques of machine learning and some other algorithms of artificial intelligence. So let's go ahead and check uh, some facts and scripts that this software actually use. Before that, let me also set a disclaimer here, and is that the software is totally free to use and modify, and we don't want any recognition. Like, what is important here is just to stop this virus that is killing humanity in every single place of the world. So let's go ahead and go to the terminal here and clear this out, right? And I will call this first script that what it does is it converts the address of a person and turns that into the geolocalization, let's say latitude and longitude, right? So I will hit the enter key and I will type this, which is my address, right? That's my address here. And I will hit the enter key and see what happened. So when I hit the enter key, it says that there is a match from the address I type with the system, and it's giving me, you can see the latitude and longitude, right? So what I will go and do right now is that I will copy them. I will copy these coordinates and go here to the Google Maps and grab my location first so you can see where I am. As you see, it says that I'm in this street, right? Which is correct because this is the address from which I'm typing. I'm recording this video at the moment, right? So what I will do right now is that I will go here and paste the location details that the system returns to me. So I will hit the enter key and check and see how accurate this is in comparison with the location that Google said that I have. So it is pretty similar, right? They are both in the same street. They are actually, probably that's my home. So what can we do with that? Okay, let's hit that key here. What can we do with that? The thing is that if we have a database with addresses, let's suppose that we grab a certain amount of addresses here, and we convert all of them into their locations, latitude and longitude, we can plot these coordinates in a two-axis coordinate system. So let's go and do that. I will do that under the curtain, so I will stop the recording for a second, and I will be back when this process is done. I will hit the enter key in here. Okay, so look what we have right now. sorry. So what we have here is the result of converting all these addresses into points. And these points are the geolocation of these addresses. Uh, what can we do with that? First, let's zoom out a little bit so you can check. Let me go back, do the zoom in here. Okay, all right, everything is great. So again, what can we do with that? The thing is that by seeing this picture, we can't do much. But what if we can split all this data into clusters? Into clusters that can group the points that are relatively close to each other. Um, to give an example, I think this is the best option I have right now. Let's suppose I want to split this into two different clusters. So I will close this and I will type in number 2 here because this is what I have, right? I will hit the enter key and I will see that the algorithm is capable of splitting the data into two different clusters with the color red and the color green. I can sum this up so you can check, right? You can check these areas that belong to the green and this also belongs to the green. That means that this point that I'm pointing here, it is more close to these green points and they can be all put into the same category or cluster. And the red points are telling me that they're related to this cross here, right? So what happened if I type a number 3, for example? Obviously, it will figure out the best way to put all together the points into 3 clusters, right? So this X now belongs to this group. The green points are into that cluster. Let me select it here for you, right? And the same can happen with the red points. So the system automatically refers to these points as if they were into the same category, right? So what it has to do with coronavirus, what it has to do with coronavirus, and what it has to do with us improving the actual situation that of collapse that the hospitals and health care system have all around the world. What can we do? So I'll go ahead and, as the software says here, and I can type W and hit the enter, and again show the points, right? And again show the points. So what these points are? Let's suppose we have a hospital in a certain neighborhood, a neighborhood that has that is in charge of this a hospital that is in charge of this neighborhood, right? And the blue points that are the result of converting addresses into latitude and longitude into points are representing right now the people that has coronavirus. So what can we do with that? Okay, first of all, let's talk about a situation that goes besides the coronavirus. And that situation is that people that don't have coronavirus right now are either afraid to go to hospitals, or when they need some medical assistance, they need to wait for some days to get what they need. It can be a prescription, it can be just a regular check, but the thing is that, for example, in countries such as Spain or Italy, right now, people needs to wait to get a prescription. Like they do need to wait because there are not enough doctors that can attend them at the moment. In the very same moment that they're calling, or that they might be in need of these um, pills or whatever, let's say like that, right? So what can we do with that? One way that is exploding totally the health system in many countries is that people is going to the hospital at the same time, and the hospital cannot cover all the people. So what can we do? Okay, if we divide this big group into clusters, we can allocate some personnel that can help channeling the issue of these people that are in need of medical assistance. I'm not talking about the patients that has coronavirus. These patients should go to the hospital and should get the treatment. But I'm talking about the people that might have the flu, the people that might have diarrhea, the people that need a regular check, right? So again, let's go back to it. So what I'm talking about is that you can divide this whole amount of patients into different groups, right? So I will type again a number 3 here, for example, hit the enter key, and put this into the spot, right? So in these points, we can locate, for example, an ambulance, or for example, some graduate students, or some people that are um, collaborating with the health systems. And these people can be given pills, can be given prescriptions. So what happened with that? That the people that is sick in the area, the people that is sick in the area don't need to go to the hospital. I'm not talking again about I'm not talking about the patients that have coronavirus. I'm talking about the people that might need medical assistance in the area. So if I need medical assistance, I can simply refer to the doctors, collaborators, volunteers, NGOs that are in this point that is marked, right? So I don't need to go to the hospital. So the hospital can mind their businesses curing the people with the coronavirus. But the people that is in need of other medical services, they find the way. They will do have the way to get what they want. Either can be a prescription or just the regular check. So if a hospital that can be here in this area, for example, is just taking care of the patients with coronavirus, and the hospital can send some personnel to this area here, as I say, maybe a student, like not just student, like 2 or 3 students. Maybe these students in this area can help the people that just need a regular check. So these people is again not going to the hospital, not stocking the pipes. So it is a way, by locating people here, it is a way to canalize the situation, to relieve the stress that the hospital here might have. This system does not interfere with the health system of any country at all. And it has many, many, many advantages. Why? Sorry. Because by looking at these clusters, for example, you can see easily how many patients you have in a certain area. You can also, if you check this periodically, let's say today, tomorrow, and after tomorrow, you can see how these groups are growing individually. So you can check the factor of exponentiation that these communities have, right? And if you detect that in a certain area are popping up more and more cases, you can send more resources here. That makes a lot of sense because uh, obviously as the virus is contagious, what is happening is that in the areas that people are infected, they are more likely to get more infections, right? And therefore, in the areas that there are more infections, the people that have other diseases will have less access to medical services in general. And that's a reality. Like right now, I know a couple of people, for example, in Poland and here in Spain, that they do need help. But when they call their doctors, they just ask them to wait because they cannot attend them. And a real fact is that in hospitals, not every personnel can help with the coronavirus. For example, pathologists, like the people who is in charge of checking someone's feet, you know, that person could really do their job if he were not in the hospital. Um, because in the hospital, his function that is checking people's feet cannot be done because in the hospital there are a lot of people with coronavirus, and when you go into a hospital that have people that is sick, then you're likely to get the infection. So again, by if the hospital is here in this area, and and again, and you, however, locate some specialists here, collaborators, or whatever that can help with taking care of the people that might need help, you relieve the stress that the hospital has right now. Uh-huh. Um, I think that's all, and that, in short, explain how can you use this approach to combat the coronavirus. I really wanted to add at the end of the video, sorry, that we are sim- simply students. We are not geniuses. We are not super smart people. We are just people that want to help. And we are people that is also in quarantine. And we were just talking and trying to convert an idea into a software that could really do something with the situation. I think that hospitals, if it's possible, should really watch this video because medicine has a lot of power to cure diseases. Medicine is awesome. They're our heroes right now. But if they are working blindly, they can just wait until this curve will slow down. I think a combination of science, mathematics, computing, and the awesome and beautiful power of medicine can really help with the virus issue. Uh, with that being said, I want to add that I'm a simple computer science student, and this algorithm is really, really easy to implement. So I'm prompting you and I'm encouraging you to help yourself. If you're a computer engineer student, if you're a computer scientist, if you think you have the tools to implement the software, I'm really, really encouraging you to call a hospital and, man, just tell them that you can help them somehow. I right now don't really have much data, but I could gather some data by myself. Obviously, this is not enough, but with the few data that I could gather, I was able to produce this result. So, man, again, if you are a computer science student, if you're a computer engineer, bro, just go and give a call to a hospital and tell them that you can help them with a tool like that. As a student, me and the medical student that helped me, we were feeling useless, and this is not how it should be because we were at home wondering how can we help, which tools do we have in our hands, and the answer is our brain. Our brain is so powerful that can really lead us to find a solution to this disaster. I think that's all. Share the video, read the article, and let's kill this virus. Let's kill this. Let's kill this hoax.